The notion that vaccines are propaganda and make you weak and sick is a misconception that has been perpetuated by misinformation and a lack of understanding about how vaccines work. Vaccines have been extensively tested and proven to be safe and effective in preventing the spread of infectious diseases. However, some individuals claim that vaccines are a form of propaganda used by governments and pharmaceutical companies to control populations and make a profit. This claim is based on the idea that vaccines are not necessary and that the immune system can fight off diseases on its own. However, this is a simplification of a complex issue. While it is true that the immune system can fight off many diseases, it is not always able to do so effectively, especially when it comes to highly contagious and deadly diseases such as measles, polio, and whooping cough. Vaccines provide an additional layer of protection by introducing a small, harmless piece of a pathogen to the body, which triggers the production of antibodies that can recognize and fight off the disease-causing agent. Another argument made by those who claim that vaccines are propaganda is that they contain harmful ingredients such as mercury, formaldehyde, and aluminum. However, these ingredients are present in only trace amounts and have been proven to be safe. For example, the mercury-containing preservative thimerosal was removed from most vaccines in the early 2000s due to concerns about its potential health effects, and numerous studies have shown that there is no link between thimerosal and autism or other neurological disorders. In addition, vaccines have been extensively tested for safety and efficacy in large-scale clinical trials involving thousands of participants. These trials have consistently shown that vaccines are safe and effective in preventing the spread of infectious diseases. For example, a study published in the New England Journal of Medicine found that the measles, mumps, and rubella MMR vaccine was 93% effective in preventing measles, 88% effective in preventing mumps, and 92% effective in preventing rubella. Despite the overwhelming evidence supporting the safety and efficacy of vaccines, some individuals continue to claim that they make you weak and sick. This claim is often based on anecdotal evidence and a lack of understanding about the immune system. For example, some people may experience mild side effects such as fever, fatigue, or soreness at the injection site after receiving a vaccine, which can be misinterpreted as the vaccine making them sick. However, these side effects are typically mild and temporary, and they do not indicate that the vaccine is causing harm. In fact, vaccines have been shown to have numerous benefits beyond just preventing infectious diseases. For example, vaccines can help to prevent antibiotic resistance by reducing the need for antibiotics to treat infectious diseases. Vaccines can also help to prevent the spread of diseases that can have serious complications, such as pneumonia, meningitis, and encephalitis. In conclusion, the idea that vaccines are propaganda and make you weak and sick is a misconception that is not supported by scientific evidence. Vaccines have been extensively tested and proven to be safe and effective in preventing the spread of infectious diseases. While it is true that vaccines can cause mild side effects, these side effects are typically temporary and do not indicate that the vaccine is causing harm. By getting vaccinated, individuals can help to protect themselves and their communities from infectious diseases, and can also help to prevent the spread of diseases that can have serious complications.